Thursday's COVID-19 press briefing. Today, Orange County Mayor will discuss the progress of vaccinations here in Orange County, and there is progress, including information on the next portal opening for vaccine, new sites for those vaccinations, and there is big news on age requirements for those said vaccines. The mayor will also discuss an extension on COVID-19 testing and our latest COVID-19 statistics. Orlando Mayor Buddy Dyer is also here to discuss vaccination progress and combating the virus in the city of Orlando. And Dr. Raul Pina from the Florida Department of Health in Orange County is also here to discuss important details regarding infection rates and state vaccinations. We will begin with Mayor Demings. Mayor.
Thank you, Dr. Williamson. Thank you to all of you for being here as we come to nearly the end of another week. We have a lot of information to share with you today. But before I get started, I wanted to do a couple of things. Yesterday, I had the privilege of attending a funeral of Orlando Police Officer Kevin Valencia with Mayor Dyer. And after spending nearly 38 years in law enforcement myself, I do understand and appreciate the work that the men and women do every day who put their lives on the line. With that, tomorrow, here in Orange County, at the Orange County Courthouse, we will be dedicating a new law enforcement memorial to those who have paid the ultimate sacrifice. And so I wanted our community to understand that it's been a challenging year, and there have been times when across the nation, in some instances, it appeared that law enforcement was at odds with the community. But here in this community, when it really counts, our community stands behind the men and women who wear those badges and go out and police our streets. And so I saw that yesterday by affirmation of those who attended the funeral for Officer Valencia. And so our hearts and prayers certainly go out to that family. And I hope that some of you can join us tomorrow night for the rededication of the Orange County Law Enforcement Memorial. Now, on to news for today. The big news came out earlier today that the state announced the expansion of the COVID-19 vaccine eligibility for full-time and part-time residents here within Orange County. On Monday, April the 5th, anyone 18 and older is eligible to get the vaccine, but on Monday, March the 29th, those who are 40 years and older throughout the state of Florida now, not just here within Orange County, will be eligible to receive the vaccine. So hopefully that was good news for the entire state. We are pleased to hear that the governor moved in the direction that we were suggesting just a week ago. This means that the state and county can now work to get more shots in the arms of those who want it in an effort to achieve our goal of reaching herd immunity, which is approximately 79 or 80% of the general population. We can all agree this is some good news, for, I think, for the Sunshine State that we have expanded opportunities. Dr. Pino has told me that we are approaching 170,000 vaccinations administered at the Orange County Convention Center alone. Here are the updated percentages of the total Orange County residents who have received at least one dose of the COVID-19 vaccine. 63.4% of Orange County residents who are 60 years old and older have received at least one dose of the vaccine. 17.5% of the Orange County total population have received at least one dose. That represents over 254,000 people. With expanded eligibility at all sites, I know that there's a graphic behind me. And if you look at that graphic, the goal that we are after, we want to turn the graphic completely a solid orange. In other words, this is a community-wide effort. We rely on your help to get to herd immunity, and I pledge to you that if we continue our outreach efforts to include all residents, especially those in our underserved communities, then our community is ripe for success. If that graphic turns completely orange, our community is ripe for success. For the last 3 days, our Orange County Fire Rescue team has led a pilot mission alongside state officials to go door to door to vaccinate and educate some of our most vulnerable residents. Since Tuesday of this week, state canvassers and firefighter paramedics shared crucial vaccine information with some 6,000 households and vaccinated 250 homebound residents. Primarily, this occurred in the Pine Hills and Lockhart areas. We received positive feedback from those who have been visited and plan to continue to work with the state to provide vaccinations to our homebound residents. In the future, we ask that you keep an eye out for the state canvassers who will be going door to door. Remember, we brought them in on Monday of this week, and we demonstrated to you what their clothing would look like and that they will have an identification. As a reminder, they will carry picture identification and will bear or wear a bright blue, green, or red shirt that says State Emergency Response Team or CERT, S-E-R-T, on it. We will continue to keep you updated on this pilot program and its next stops in the coming days. And now for a news flash. We will open our registration portal for vaccination appointments for the Orange County Convention Center at 9 a.m. on Monday, March the 29th. This will include registrations for all persons 40 and older, all persons 40 and older. Meanwhile, there are lots of options for residents to get vaccinated here in the county. The FEMA vaccination sites do not require any appointments and are walk-up only. Please visit our website at ocfl.net/vaccine to find out about the FEMA sites as well as other opportunities for vaccinations at local pharmacies such as Walmart's and Publix and CVS. At the South Orange Youth Complex satellite site that ran for 3 days from March 21st through the 23rd, a total of 1,363 were administered vaccine. Since FEMA's Valencia West Campus Hub site opened as a 7-day-per-week site, they have administered over 55,000 vaccines. The site runs from 7 a.m. to 7 p.m. Please remember that if you are seeking the first dose of a vaccine to arrive early in the day, as the amount of first doses are limited. So again, we ask that you get there early. Just to give you some feedback, Miami Spoke site was doing about 61,000, and we are number 2 in the state, the second highest vaccination site for the Valencia site. And that's good news. We are moving along at a fairly good pace. There's also a vaccination opportunity at the South Trail Library branch, which is located at 4600 South Orange Blossom Trail. This vaccine site also operates 7 days per week from 9 a.m. to 7 p.m. or until the supplies run out. I will admit that we deliberately repeat some of the information that we have previously shared because we know some viewers are hearing this for the first time. There are free rides for anyone 60 and up who needs transportation to a vaccination site. You can call 311 and arrange for a free ride through links to the FEMA site at Valencia's West Campus or to the convention center if you have an appointment. Since making this available, Links has made 476 trips to vaccination sites with 293 people served. Let me just say thank you to Links and to those bus drivers who have been assisting our vulnerable residents. Again, you can get information by visiting our website at ocfl.net/vaccine. And now let me talk a little bit about the numbers, our COVID numbers. Since the start of the pandemic, 121,574 cases of the coronavirus have been reported within our county. The disease still remains a threat. There have been 1,173 residents who died of the COVID-19 virus. Our friend Dr. Pino will talk more about the recent deaths and other information about variants and the virus in general. Our 14-day positivity rate is now 5.79%, so roughly 5.8%, and that has gone up slightly. You're going to hear from Dr. Pino also about that. When we talked earlier today, Orange County is seeing an increase in infections among individuals 18 to 25, which is another reason why we must make the vaccine available to younger age groups sooner than later. I'd like to stress to all of our young adults and young people that there is free COVID testing available. Orange County continues our commitment to free testing as part of our efforts to fight the pandemic. That is why we have decided to extend free coronavirus testing at Barnett Park. As you all know, it was due to end the end of March. But we have decided to extend that through April the 30th. We believe that that will assist our residents who desire to be tested, and they have the opportunity to make good decisions or better decisions with knowing their status. Testing at Barnett will again continue through April the 30th, and we are seeing 800 to 1,000 tests per day. And that really indicates that the demand for testing remains high within our community, and we didn't want to end that without having some options for our residents. In fact, yesterday at Barnett Park, 1,189 tests were administered, and the state's regional testing site at the convention center, they administered 1,282 tests. So thank you to our dedicated workers who have been providing that service through our Health Services Department and working in partnership with the Department of Health for months now. They have done so in the heat, the rain, the cold, etc. So we do appreciate their efforts. To conclude this week on a positive note, I would also like to take this opportunity to congratulate the local Facebook group called Million Mask Challenge, We Need You, for its outstanding contribution to our community during the pandemic. This initiative began 1 year ago with Andrea Ruiz Hayes as a way to connect local crafters with those who needed masks in our community. As you recall, when we first went under the state of emergency, there was no mass production of facial coverings or protective masks at that time. And so we had community-based organizations who stepped up to the plate to assist our residents. So I'm proud to say the group has sewn and donated 100,000 masks for the state of Florida alone and an additional 40,000 nationwide. Thank you to all 18,000 members of the group for your dedication and passion for helping your fellow neighbors in times of need. And with that, I'm going to turn it over to Mayor Buddy Dyer.
Thank you, Mayor Demings, and good afternoon, everybody. Certainly the last 12 months have been filled with challenges, but we've adapted to stop the spread and protect others. We've mourned those that we've lost to the virus. So I want to thank everybody in our community for their response to this pandemic and for again showing that one of Orlando's greatest strengths is its kindness and its compassion. We know that thanks to the vaccine, the day when we can safely gather without concern with family and friends for celebrations and holidays is coming. A day when restaurants and shops are not filled to 25% capacity, but to 100% capacity. So I am happy to learn that beginning on Monday, all residents across the entire state, the age 40 and older will be eligible, and then the following Monday that all residents 18 and older will be eligible for the vaccine. And I want to thank the residents that have already taken the vaccine, and want to ask them to, in addition to protecting yourselves and those that you value, that you love, I want to ask that you become advocates for our community and encourage family and friends to get vaccinated as soon as it becomes possible. And a week from Monday, it's going to be possibly for virtually everybody in our community. So I encourage everybody to make a plan on how you're going to get vaccinated. There are many different sites, as Mayor Demings has described, and some are walk-up and some are by invitation. So there's going to be a large block between that 21 and 40-year-old that ought to start making preparation on how you want to go about that. Share also, if you've received it, that it's safe, and let the others understand how critical it is for our region's recovery that everybody get vaccinated. We remain focused on controlling the spread of the virus, so our recreation staff and firefighters have worked together with the health department to identify residents that are 65 and older and unable to leave their homes and need mobile on-site vaccinations. So I want to thank Dr. Pino and the Department of Health for assisting us with that. In addition, Dr. Pino will talk about mobile units that will be in various neighborhoods that can administer up to 1,000 vaccines to residents in a single site. So I want to thank Dr. Pino and the Health Department, and of course the federal government for the site at Valencia and the Spider sites that have been out there as well. And last, I want to highlight one more place to have an opportunity for vaccine is at Trotters Park tomorrow, 10 a.m. to 5 p.m. It's a mobile vaccination site available to walk-ups, and that'll be a Johnson & Johnson vaccine, so it'll be open tomorrow according to the state criteria. Thank you for being here today. Dr. Pino.
Thank you, Mayor. So right to the numbers, our recovery rate is 97%. The mayor gave you the number of the total infections, and our 14-day rolling positive rate has increased a little bit. I want to show this graph first because something is happening with the pandemic right now. As we have vaccinated a great number of the older segment of the population, the younger segment of the population, 18 to 25, the number of infections are increasing. And that's the line on the top. And you see how they diverge and mimic each other, especially the one in the bottom and the one in the top. So the more that we are reducing in the older segment, the more that is increasing in the younger segment of the population. So the infection continue to be active. And also this could be early signals of spring break transmissions. We don't know yet that as we are interviewing individuals, but it probably will go up even a little bit higher in the younger segment of the population. So it is critical important that as soon as this open for 18 and younger on the 5th, that people get vaccinated. We have seen a significant reduction on the number of hospitalizations and the number of deaths. The death rate has decreased significantly. But interesting enough, a third of all people who are hospitalized in our county for COVID-19 are younger than 45. So that's another indication that is fueling in the younger segment of the population. And also, we have seen the median age is not right now, yesterday was at 30 and 30 years old. That's also another indication that is going into the younger segment of the population. So as much as we are protecting the older segment of the population, as we go into 18 and older, we need people to continue to watch the distance, to wear the mask, and to wash their hands, as this is not over yet, although there are some good signs in the data, as I mentioned to you. Since we talked to you last time, 5 additional individuals have died. And just to give you a perspective, and one is too many, But a few weeks back, we were reporting to you 27, 19 between press conferences. So there's an indication that that is also slowing down, which is all a very good thing. The 5 individuals were white, 2 were Hispanic, 3 were non-Hispanic, 4 had unknown conditions, and 1 didn't have any pre-existing condition. And only 1 of the 5 was in assisted living facilities. That's another place that we have seen a tremendous reduction of the number of infections. If I don't recall incorrectly, right now we only have 9 residents that are positive to COVID-19 in assisted living facilities. And we were in the hundreds a couple of weeks ago. So that's important to make the point. The infection continues to be active. It's more active in the segment, in the younger segment of the population. And vaccine has been very effective in reducing infection, transmission in our community, hospitalization, and death. So as soon as the vaccine opens for you and you have the possibility to be vaccinated, get vaccinated. There are 3 main reasons to be vaccinated. First, it's free, and it may not be free forever. At some point, things could switch in the future when the pandemic is at some level of control. Second, it doesn't matter if you have insurance, don't have insurance. It doesn't matter anything. You can get the vaccine. The second reason is to protect your family from getting this infection, protecting the elderly. And remember that we have seen cases of people who have acquired the disease even after being vaccinated. That's a possibility. So we have to continue to protect the elder segment of the population. And the most important reason, protect yourself. Right now, you have the opportunity to protect yourself. As the mayor mentioned, the appointments would reopen on Monday for additional 400 a day. We already filled early this week and next week. We already have for next week over 18,000 appointments at the convention center, and we are going to open another few more to add more first doses as we get vaccines into our county. For the variant cases, we have continued to be at 21 that have been officially reported, and they all are from the UK variant. Moving into immunization, and before I give the COVID-19, because when I give the COVID-19, then nothing else matters, I want to give this information first. This year, we are not going to have a back-to-school event, meaning we are not going to open intense vaccinations during the summer for students to have the vaccine ready for school, because we cannot do both. We cannot vaccinate the entire population and also the students. It is important for the parents to seek vaccination for their children, especially those who are going from 6th to 7th grade, needs to have the Tdap vaccine. Now, I understand that the Board of Education is also working with a strategy with a private provider that we are in contact as well that may come into schools and do the Tdap. So it's important for parents, when you receive the package from the school with information, to sign the consent, because the vaccine will not be able to be given if your child doesn't have a consent in file to receive the vaccine. This is a vaccine that they already had. It's just a booster that they get in 6th grade. Again, it is important for that consent form to come, because comes next cycle of the school year, your child may not be admitted in school because that vaccine is missing, and that's the Tdap vaccine. We did a test run with this group, if you remember, for the flu, and it worked very well. So we think that this initiative, if the Board of Education and the provider get into a final agreement, will be a great thing for the schools. It will facilitate getting vaccinated. It will prevent parents from having to take time off to get their children vaccinated, and it's all free again. So now to the numbers. In our county, we are approaching 500,000 doses. We are at 416,241 doses. This is doses, not individuals, has been given into our county. Of those, 365,733 have been given to residents of Orange County. For people over 60 years old, we have given, administered 262,568 vaccines. And for Orange residents over 60, there has been 222,401. Now, complete series in our county. That means they either have the 2 doses for Johnson & Johnson, the 2 doses for Moderna, the 2 doses for Pfizer, or they have Johnson & Johnson. So in complete doses, 125,777 individuals are fully immunized in our county. And that is 8.89% of our population. Now, that percentage is a little bit higher if you exclude 18 and younger, because that segment of the population is not getting vaccinated. But I give you the total number as a percentage of the entire population. Now, for percentage, residents receiving 1 or more doses, 254,065, and that's 17.95% of our population have received at least 1 or more doses. For residents over 60, as the mayor mentioned to you, 143,278, and that is 63.3% of our population. With that, any question that you may have, I would be more than willing to answer. Thank you.
All right, thank you, Dr. Pino. We will open it up for questions. We do have from the school district, Mr. Scott Howard joined us. We also have Mr. Tim Boldick from our compliance team. We have Commissioner Myra Uribe has joined us, and Commissioner Maribel Gomez-Cordero, and we have Ms. Ilia Torres to do Spanish translation. So with that, we'll open it up at this time.
Lauren Seabrook, Channel 9. My question's for Dr. Pino.
All right. You're back, Doc.
Dr. Pino, I'm curious, with the way the vaccine rollout's going, moving to 40 and up, and then making it available to everyone, how have your expectations changed for when we might reach herd immunity? And are your staff, are you guys tracking like that along with the number of people who have been infected that might have some natural immunity?
We haven't had the number of people that may have a natural immunity. Because when you look at that, it's probably higher than we think, as the number of asymptomatic infections was higher than we expected. So in reality, immunity right now is probably higher the percentage that we are offering. And the state is also advising that because we are not receiving the VA data yet, they report directly to the feds, our coverage rate could be 5 to 8% higher than what it is right now. So yes, we know that we are under-reporting, and that in this case is a good thing because it keeps us on the edge and continue to work harder on this. So it depends of also the volume of vaccine available. The more that we get, the more that we can give, the quicker that we can reach those points. But also remember, Orange County is a hub, Orlando is a hub for the entire region. And about, I believe, is 65% of the people vaccinated at the Orange County are Orange County residents. The other percentage are not. So we're also offering services to the surrounding communities. We have those percentage. If someone is interested, we could disclose those. So we are ready to expand with close pods in places like UCF and large employers in the county that will accelerate our ability to reach that percentage. But again, all depends on how much vaccine we get.
So when do you think we'll get there?
I don't have an idea, really. It's very difficult to project that. And also, it's going to, I don't know if we will not reach that percentage right now with the level of hesitance that we have in the community. And that's an important element to keep in mind. We have some level of hesitance to vaccination, and that could hamper our ability to get into the 70s.
Troy Campbell with News 6. This question is for Mayor Dyer. You mentioned gatherings are soon likely to be happening. With vaccines opening up, we've heard the president mention the 4th of July. Have you forecasted what you think with the vaccine increases, what city parks might look like for 4th of July, like Yola? A lot of people want to get back to what they call, a little more normal.
Yeah, we haven't made that decision. Obviously, we did last year's 4th of July as a virtual event. So we're going to have to make that decision pretty soon because of the lead time for vendors to make decisions and be prepared for that. But we have not made a decision on fireworks displays for 4th of July.
Amanda Dukes with Channel 2. My question's for you, Dr. Pino. You were talking about the urgency you feel to encourage people 18 and over to start getting vaccinated once they can. Do you have a concern about vaccine hesitancy, especially among that age group, the younger group, people in their 20s? And if you do, what would you say to them to convince them to get vaccinated?
So keep in mind that even I have a 21-year-old and a 28-year-old, and they are still kids, in that sense for the parents. So I think that, yes, the level of hesitancy in individuals of this age may be higher, not for the same reasons that we have in the older segment of the population, but because they are afraid of getting vaccinated, and many in the younger. So the role of the parents to encourage their kids to get vaccinated is going to be important. And we are counting on parents to guide the younger segment of the population to get vaccinated and to get vaccinated quick. Listen, I don't want to scare anyone. That's not our role. That's not what we do. And we have tried not to do that. But this virus has many unknown factors that we are discovering. So the quicker that we can get rid of this, the better that it will be for all of us.
Lara Greenberg, Fox 35. This question is also for Dr. Pino. When we opened it at the convention center to 40 plus, I think those appointments, there were 7,000. They sold out in 13 minutes. Not sold out, but you know what I mean.
Yeah, I don't want to go to prison.
Is that a concern?
I'm not selling anything.
Is that a concern here as you now open it to 22 years more worth of people in the county?
Well, I think that, the governors have better information than we have, and they probably have projections in the number of vaccines that are coming. And I think that those decisions are also based on the volume that they are expecting. There's going to be an increase of demand for sure. Are we going to be in a similar place that we were when we initially opened in January, where we have people claiming for the vaccine? Yes, that's going to happen. But in 4 weeks, 6 week time, we will be in a point that anyone can get the vaccine at any time. And even at 3,400, we could increase the numbers at the convention center a little bit. That side is so resilient. The more that we increase the number, the better it works. I don't know why, but we are starting 500. We increased to 1,000. We went to 15. We went to 2,000. We went to 25, 30, 3,000, and now 3,400, and continues to work and continues to do well. We think that we can go up to 3,700, but again, we don't have that volume of vaccine yet to sustain that.
This is Melissa Thomas of Florida National News. Dr. Pino, this one's for you too. Just come on back around. Great news in terms of the number of variants being steady, but are you concerned, and is your office prepared at all in terms of the possibility of an increase in variants once all of the data from the spring breakers come in?
Yeah, listen, there's not much that we can do about the variants in a sense that I have explained. This is also always retrospectively. You learn about the variants when it already occurred. We have not seen the numbers that other places have seen in the country. And there's an effort to detect it. I don't know if it's just not happening or we are not being good enough to detect it everywhere that it is. But the team is prepared, it's ready, they are interviewing. Thankfully, we don't have that many different variants going on. It's just this one from Britain. And we hope that it keeps that way.
This is Steve Hurek from the Orlando Sentinel. This question's for Mayor Demings. I was hoping you could clarify some numbers and maybe tell us what these mean. You said that the CERT group, the canvassers, had visited 6,000 households, but only 250 people were vaccinated. Why would that be? And the other one is that there were 476 links trips to the convention center and only 293 people vaccinated. What happened?
I think they were probably counting double trips, various things. Sometimes perhaps someone took a ride to the convention center where they needed an appointment and they didn't have one. So that may explain the difference there. In terms of, I think, the canvassers, I'm told that they actually knocked on some 13,000 different doors. However, they left information and provided information to some 6,000 households. So perhaps that means that some of the doors they knocked on, there was no one there, but they shared information with some 6,000. And so out of that 6,000, yes, 250, they reached the maximum available doses that was allotted for that particular mission. So we are dependent upon the state to provide the inventory of a vaccine. And so as a matter of fact, when I was here, Dr. Williamson shared with me that apparently this afternoon they reached the capacity of the available supply that the state provided for the mission, which means that unless the state renews the mission for another area, then that program may end, and we may look at doing it in another way here within Orange County, because we don't control the supply. Again, it's controlled either by the federal government and then through the state, and we look to engage in efforts that is going to increase the total number of people who will be inoculated. Our outreach has been really focused in some of those underserved areas that seem to be a challenge to get the numbers up. And so we're going to continue our efforts in that regard. We will continue to work with the local churches and faith communities and others to try to get those numbers up. But we submit our request to the state for inventory, and the state says yes or no, and depending upon the supply, we have contingency plans to do significant other missions, but until we get the supply up, we can't move forward with some of those initiatives.
May I have a quick follow-up on that?
Yes.
Sorry, Jeff. In that context, then, it sounds like it's been very successful, but that it could be even more successful if we had more higher volume.
If we had, I say it was successful because I believe that in dealing with vaccine hesitancy, you have to share information with the public. So even if the number of people who made the commitment, given the eligibility criteria, you had to be 50 plus and homebound, if that eligibility was broader, more people in those homes where we knocked on doors likely would have agreed to be vaccinated. But we were limited by supply. So if the supply increases and the eligibility criteria is relaxed, then we would be able to vaccinate many more people when we're out in those neighborhoods. So I think that as the state moves forward, we're trying to make any policy decisions regarding this, they're going to have to take all of this feedback into consideration. And we'll help them with that, of course, to share what we think the eligible criteria should be. And there are other communities or neighborhoods that we would love to move the program to. Okay.
I apologize if you've already addressed this. I just stepped back into the room. But with the expanded eligibility and with a good 30-some-odd% of the county's seniors still not been vaccinated, do you feel that when the eligibility expands to 18+, that are you concerned that the remaining seniors who are looking to get the shots may be somehow squeezed out of it? Or is there the possibility that, do you feel confident you'll have enough supply by then in order to accommodate them all? Or are you planning some kind of giving seniors priority? Have you thought about that at all? And if so, what does that look like?
Well, I don't believe we'll get to 100% of the seniors for many reasons. Some of it may be for medical reasons. But we're going to try to get up to at least that 79, 80%. And with the additional efforts through the retail pharmacists, through the doctor's offices, through the community health centers, through some of these community engagement projects that we are working on, we will get that number up. In some cases, I believe that with the homebound program, I would say that it's somewhat successful there. We will continue to communicate to the members of the public that we have numerous opportunities throughout the community for them to be able to get vaccinated. So I'm going to remain optimistic. We still have months to go, likely, before we reach that herd immunity. Dr. Pino shared with you that there's going to be some challenges, I think, getting the numbers to that point. It, again, will take all of us. There was a graphic that I put up earlier. I don't know if you saw that graphic, but it was of orange. And once we get that graphic solid orange, that means that we have reached that herd immunity point, and we're months away from that. However, in terms of the supply, the federal government and the state are increasing the available supply significantly. So we have been limited by supply. We have been limited, I think, in some instances by the vaccine hesitancy. So it's going to be a bit of a challenge for us to convince people, the remainder, why they should get vaccinated. Has everyone in this room who could have been vaccinated, have you been vaccinated? Raise your hand. A few, okay. So is there anyone in this room who could have been vaccinated that hasn't been vaccinated? Raise your hand. Okay, they would never do that on camera. I know that at this point because that's a small group of people. But we're going to continue to work, for example, with our local elected officials. Commissioner Uribe and Commissioner Gomez-Cordero have done yeoman's work within their respective county commission districts doing outreach. You see various city commissioners who have been doing the same. So we're calling on the entire community. We're going to need our faith leaders to, within their congregations, encourage people to want to get vaccinated. And even within the healthcare field itself, we probably don't have 70% of the healthcare workers who have been inoculated. So we have to continue, I think, convincing the remainder of the population who should get vaccinated that they should do it. Okay. We have a few other questions. These are questions that came in via social media or otherwise, I guess.
Yes, sir. Mayor Demings, the first question is for you, coming from Martin Comos with the Orlando Sentinel, and he asks, Orange County is scheduled to receive a total of $270 million from the American Rescue Plan Act. The first half of that money, about $135 million, will be sent to Orange County in mid-May. Have you and your staff started laying out a plan as to how Orange County plans to use those funds whether it's for mortgage assistance, rental assistance, infrastructure projects, et cetera? And is there any consideration by Orange County of returning to the federal government any unused funds?
Well, we never want to give back money. So we do have plans, contingency plans. We have been awaiting the final specific instructions from the U.S. Treasury Department on the criteria for expending the funds. We likely, with the additional funds that we will receive, will not spend it on rental assistance because we received a separate pot of money, a separate $33 million for rental assistance. So these dollars are likely going to be used to assist individuals, families, small businesses, and I'm going to say social service providers in our community to assist us with our recovery efforts and to make sure that we don't push people to the point where they become homeless, they have various mental health issues. We want to make certain that there's adequate funding to deal with that. And perhaps even from a preventative health care perspective, we want to make certain that we're addressing all of that going forward so that we can come out of the pandemic better than we were before.
Thank you. And the next question is for Dr. Pino, coming from Holly Bristow with Fox 35 News. And she asks, how are you gearing up for the governor's announcement regarding opening vaccines to 40 plus starting on Monday and everybody starting the following Monday?
So for the 40, we were already, the county operating side was already doing it. So in that sense, that one is done. We are preparing for the increase in demand, which is interestingly enough, and people should know this also, is that at the same time that we are doing first doses, we are doing second doses. And sometimes the limitations in the appointment is because people are already scheduled automatically to take the second dose. So again, it's going to be an initial period where the demand is going to be a lot higher than ability to fulfill that demand. But we expect that similar to what happened when it was open to 65 plus, that demand will last 3 weeks, 4 weeks, and then after that, things will level off, and we will be able to keep up with it.
Great. And the next question is also for you, Dr. Pino, coming from Ryan Lynch with the Orlando Business Journal, and he asks, with the vaccine becoming available for more people soon, what level of vaccination do you expect the county to allow businesses to return to more normal operations, and what factors would encourage moving in that direction?
I can't answer that question because it will not be my decision. That's a political decision. I will advise the political forces as a public health official, but I would not be making that decision.
Okay, thank you. And lastly, this question is coming from Deanna Albritton with WFTV, and this is for Mayor Demings. Mayor Demings, how do you feel about minority vaccination rates now? Have they gotten better? If so, what things in particular do you think that have helped the most?
We're still lagging behind with vaccinations within minority communities. The rollout initially by the state was not what it should have been, and we're playing catch up. But we're getting better, and we have a number of initiatives as the state provides additional inventory or the federal government. I believe that we'll be able to close the gap.
Okay, thank you. That's the last question.
Okay. Well, since that was the last question, Dr. Pino, I like when you come, they don't ask me all the questions, so we're not going to let you be absent anymore. Commissioners, did we cover everything? You all want to cover anything? Okay. All right. Thank you all. The next press briefing will be on Monday at 4:30. It'll be right here. Have a great weekend and stay safe.